People should make it their business now to know about HIV, really at a personal level. Who would be the first person I can tell? Will I be safe with that person? Where would I go for treatment?
Dr. Lydia Buzalira is the Director of Community Management at the AIDS Healthcare Foundation, Uganda Cares. She says the thought process should include other chronic diseases that people live with.
Once you test and know your status, you access treatment, you access information, and you can live longer. And like most diseases, you can live and die with it. When you have diabetes, you can live and so long as you have treatment and prevention and you know how to handle yourself, you can live with the diabetes for a long time. Hypertension. There are many chronic diseases that you can live with, but so long as you live positively and you live a happy life.
The Director of Health Services at the Ministry of Health affirms that it's easier to go for an HIV test once empowered with such information.
HIV testing is a key intervention in the elimination of the mother-child transmission. It is also a key intervention for entry into the antiretroviral program. So we encourage HIV testing for everybody, especially the sexually active people.
This aspiration of getting everyone tested for HIV may be far from being realized, going by the attitudes that many people have displayed.
What's important though is to make it attractive, to get case studies, to get champions.
This year, President Museveni and his wife did just that, champion HIV testing. She says stigma and discrimination are among the biggest stumbling blocks.
We still have cases where people are laughed at, people are ridiculed, people are pointed out for being HIV positive.
The fact that most testing services are located in the public sector hasn't helped matters.
You know who goes to the public sector? It's usually people who are willing to queue, people who want a free service.
Many, though, do not have the patience, especially those with demanding jobs.
You know, and I have to continue with my life outside work. So when do I find the time for myself to think about my health?
This state of affairs prompted the AIDS Healthcare Foundation, Uganda Cares, to partner with institutions with a large workforce to set up HIV testing centers in offices like this one at Jubilee.
We have the service available, and staff from time to time can excuse themselves.
The turn-up is really good, and work is not interfered with. They continue with their daily routines.
Etayu says the companies covered by Jubilee Insurance in Uganda have also started demanding for such services.
All these schemes at least have a test once every year.
At his own company, Etayu says taste days are always embraced with a lot of enthusiasm.
People just walk into test. I don't know whether they do this because they already know their status or they're really eager to know, or that they have been sensitized enough. But really the turn-up is good.
But going to workplaces requires a lot.
We work with the human resource managers, and we explore what the HIV workplace policy for that institution is, how big the workforce is, how willing they are, and then we schedule a date, and this date is publicized.
For 4 years now, there have been testing and counseling people at work.
Especially for the positives to continue with you and get you into a care and treatment facility.
Disclosure to the human resource manager is on a voluntary basis after one has granted permission.
Because there are benefits in actually revealing that information. Are they going to be protected? Are they going to be facilitated to live a positive, meaningful life in this workplace?
To the places they go to, they register about 70% success rate of testing. According to Alice Kayungo, the policy and advocacy manager at Uganda Cares, the testing will greatly contribute to the achievement of the set 2020 targets.
We are pushing for 20 million people to be put on HIV treatment by the year 2020. Having 20 million people globally being put on treatment by the year 2020 definitely means that we have to scale up testing, and that directly translates into scaling up treatment.
An increase in domestic resources and its proper utilization would go a long way in solving the perennial problem of inadequate test kits and drug stockouts.
And we will also see the availability of appropriate drugs, not bitter pills that are actually putting people off treatment, but drugs that are helping people be maintained on treatment, and in that way we will see their viral loads being suppressed.
Uganda is yet to actualize the AIDS Trust Fund.
HIV testing has increased. We started from as low as 20%, now we are at about 70% of people who are testing, and especially couples. We test all women who go to antenatal care, but of course we are not at 100%. And we think that going to the workplaces, in factories, in hotels, in institutions is one way to increase access to HIV testing.
The important issue is for those people who need to test more regularly, and also knowing what your status and that of your partner is.
Testing is part of the UNAIDS target of ending the AIDS epidemic by 2030. Florence Naluyimba, NTV.